Hi, I'm Dr. Miles Mack. I'm Senior Partner at Dingwall Medical Group, and this is an update for our patients on the 30th of December 2021. Just to say that we are presently seeing this early stages of the Omicron wave that we believe is going to hit our area very shortly, and we're seeing a sharp increase in numbers, and we're expecting this to have a major effect. As a result, we've slightly changed the way that we are working because we're never quite sure which doctors or which other members of staff are going to be able to come into work on the next day due to problems of either infection or shielding because of our other close contacts. We are still seeing patients face to face, but we will be doing more by phone and we will be having far fewer appointments for more regular things, so please bear with us in this time. We're particularly grateful for all the kind of words that have come to our staff and your consideration for the very difficult job that they're doing to handling your calls at this present time. We're calling out for people to get vaccinated, and particularly to get your booster vaccine for the people who've had the first and second doses, but also an opportunity for people to get the first and second doses who've so far have not managed to get that. We think that's really important, not just for the at-risk and elderly, but for the entire population. This will keep yourself healthy and fit from infection, but it will also protect those people around you and will protect the essential workers who are so essential for keeping life as we expect it. This isn't just healthcare workers such as doctors and nurses, but our staff. It's also the care staff looking after elderly people in their homes, in their care homes, and also people who are providing us with the routine services that we come to expect and make our life so important, such as food deliveries and all the people who doing the quiet work to keep our lives normal. We have done an enormous amount of vaccines in the last year. At the time of recording, we've done 23,000 COVID vaccines. In addition to that, we've done nearly 6,000 flu vaccines in this last year. This work's been over and above our normal clinical work, but we think this has been hugely important, and we're just having the last push to see if we can just increase those numbers yet further. We still think there are almost 3,000 patients who haven't had their COVID boosters recorded in their patient records. There may be a delay with people having had their COVID boosters at NHS Highlands sites rather than the health centre, but we still think there's a significant number of people who would benefit from this. We've got our last COVID clinic on Saturday the 8th of January, and we're calling out for people to come along then to get vaccinated. We'll give you a first dose, a second dose, or a booster as required. If you'd like to avoid queues, please phone us in advance. Please call 07803 596 071. That number will be able to put you directly through to one of my members of staff who'll be able to give you an appointment. Please call between 9 and 5 and we'll be able to sort that out for you. If you don't have an appointment, please don't be put off. Come along. As long as we've got vaccine, we'll give you a JAG. You may well be asked to wait, or you may well even be asked to come back when things are a little bit quieter later in the day, but we'll do all that we can to vaccinate as many as we possibly can on that date. Thank you for all your consideration at this difficult time. We'll do what we can to continue to provide normal medical services. In addition, we'll be here to deal with people as they become unwell with COVID or other illnesses, and we'll look forward to seeing anyone who hasn't been vaccinated on the 8th of January. Thanks very much.